everyone, so today I just wanted to have a quick chat about looking after your pelvic floor whilst you're pregnant, because pregnancy itself puts a lot of load or pressure on the pelvic floor, regardless of when it comes to time to giving birth. Even if you have a cesarean, still the weight of the baby throughout the pregnancy puts that gradual load on the pelvic floor over time. So it's really important that throughout the pregnancy you're aware of your pelvic floor. There's three things that would be really useful just to be mindful of throughout your pregnancy or take note of when it comes to your pelvic floor health. So the first thing I recommend is getting an assessment done by Women's Health Physio, just to give you some really detailed feedback about where your pelvic floor is at. They can either use a real-time ultrasound, which is a little bit less invasive as a first sort of step, or otherwise do an internal assessment to give you some really valuable biofeedback. I think this is particularly important because sometimes women might think they've got a weak pelvic floor when in fact they have an overactive pelvic floor. And we need the pelvic floor to be strong but also flexible, particularly when it comes time to giving birth. So as a first protocol, that gives you some information about where you're at. Secondly, throughout your pregnancy, it's about trying to minimize the load that you put on your pelvic floor, the extra load, because you've already got the weight of the baby there. So doing things like avoiding high impact activities, which you possibly might do anyway because you're pregnant, but things like running, jumping, but also squats. A lot of women I talk to don't realize things like squats and lunges, particularly if they're quite loaded or doing quite wide starts, that can be quite heavy on the pelvic floor. Getting some advice from your physio about an exercise program that's appropriate for your pelvic floor can be quite helpful with that. And thirdly, the other thing is resting, which it can be very difficult if you've already got other children. I know that for a fact. But I do find that just taking 5 minutes at the end of the day, lying down is the best place to rest. It's better than sitting in terms of offloading your pelvic floor. Doing some mindful breathing and focusing on some awareness around your pelvic floor is also one of the most helpful things you can do.